Okay. So, hello, my name is Elizabeth Giesenhaus. I'm a student nurse at Jamaica Community College. I have checked my chart, and I have washed my hands, and I have provided privacy. Can you verify your name and date of birth?
Daniela Garcia, May 9th, 1992.
Okay. That matches my chart and matches your wristband. I have already done Daniela's vital signs. Her height is 5'1", her weight is 146, so her BMI is about 27, which would classify her as overweight. Blood pressure is normal, 118/78. Heart rate is about normal, a little high, it's 98. Temperature is 98.1. Respiratory rate 16. Pain on a scale of 0 to 10, she's a 0. And that's... Oh yeah, I have checked her health history. What else? I've checked health history. Oh. And I'm assessing her level of consciousness. She's talking and awake, alert, and oriented. Like where she is right now. Okay. So I would do a general appearance assessment. She looks normal, aware, all of that. I'm assessing her scalp and head, and I'm looking for any lesions on her scalp. Assessing her hair. Her hair looks coarse, but shiny. I don't feel any bumps or lesions of any kind. And then I would go on to checking her eyes. And can you, like, pull down on your, okay. Okay, the inside of her eyelids is pink, and there is no drainage or discoloration. Sclera is white. Okay, so I'm going to assess her eyes now. Okay. Pupils are equal and reactive to light, and on the pupil gauge is about 3. And then I would assess the cranial nerves. So, if you can follow my finger. Okay. I've assessed cranial nerve 6, which is the abducens, for lateral eye movement. I've assessed the 4th nerve for the trochlear nerve for the crossing in of the eyes. I've assessed nerve 3 for general movement of the eyes, the oculomotor nerve. Okay. Can you tell me when you see my finger?
I saw your name.
When is that?
That's good. When was your last eye exam?
3 months ago.
Okay. So that's been within a year. I'm going to assess her ears now. This is different from what we've studied with practice with. Okay. Yes. Okay, I see her, what's it called? Tympanic membrane. It is gray, it is a pearlish gray and shiny. Tympanic membrane. Okay, I see her tympanic membrane in both of her ears. Pearly gray. I do not see any discoloration. So can you occlude one of your nostrils? Okay. You do sound a bit congested, but I don't see that there's any kind of blockage. I'm going to test your olfactory nerve. So can you close your eyes and tell me if you smell something and what do you smell?
Smell alcohol.
Okay. That is an alcohol pad. Okay. Can you stick out your tongue and move it side to side? Okay. Puff your cheeks. Okay. Smile with teeth. Frown. And clench your jaw. Okay. And I'm going to assess cranial nerve 7. I can't get this one open, so I can't assess cranial nerve 7. Okay. So close your eyes, and I want you to tell me if you can sense softness or sharpness.
Soft. Sharp. Soft. Sharp.
scrunch your face. I forgot this one. Yeah. Okay. I'm gonna come behind here and check your 11th cranial nerve, which is spinal accessory nerve. So I'd like you to shrug. Okay. And I'm going to assess assess vagus and assess her thyroid. So can you swallow? Okay. It's also part of the spinal accessory. The 11th. Can you turn your face side to side? Okay. So I'm assessing her nose. It looks symmetrical. There don't appear to be any bumps or lesions on her nose. She does not appear to have broken her nose in the past. I'm going to check her sinuses, the frontal sinus, the ethmoid, and the maxillary. Okay. Feel me booking you in the nose or something. I see redness. I don't see any discharge. I don't see any bleeding. Again, I see just redness, no bleeding, no inflammation. Okay. As we've just said, I do not have a tongue depressor, so I would assess the inside of her mouth. I would move her tongue. I would check the sides of her tongue and underneath her tongue for any lesions or bumps, any type of mouth cancer as they tend to develop there. I'm assessing her gums and her teeth. Teeth are white, gums are pink, they look healthy. Lips do appear to be a bit chapped. I would assess her gag reflex, which is the ninth cranial nerve, glossopharyngeal. I think that's it. Tuning fork, we don't have one. Okay. I would assess the 8th acoustic cranial nerve. And I do not have a tuning fork with me, but I can do the whisper test. So, go for that.
21. 22.
Okay. Okay. Squeeze your fingers. My finger. Push. And pull. Okay. And push up. And push down like you're pushing on a gas pedal. Okay. Same. Good. Okay. I'm going to assess for lungs. Are you a smoker?
No.
Okay. Have you ever been a smoker? Like a
No.
regular smoker?
No,
Okay.
don't smoke.
Do you have any conditions that would affect your breathing, like asthma?
No.
Okay. Right, I'm going to palpate for crepitus. Which technically I wouldn't have to do. Okay, I don't see any crepitus. Feel any crepitus? I'm going to test for bronchophony. So can you repeat bronchophy? Can you repeat 99?
99. 99. 99. 99.
Okay. And I'm going to repeat the same test on the front.
99. 99. 99. 99.
Okay. If she had any fluid, or if I believed that there were any fluid in her lungs, I would do the egophony test and the whisper test, but I do not believe that she has any fluid in her lungs at the moment. I'm going to percuss her lungs. Okay. Okay. I'm going to generally auscultate her lungs. Okay. Start brachial. Breathe in through your mouth. front. And follow ladder pattern. I'm gonna repeat the same thing. Okay.
I'm glad I made it easier and not harder. I mean, I
Capillary
think
recall.
if you'd have gone with like Sarah or something, it would have been hard. She stresses people out.
Okay. Her capillary refill is less than 3
knows
seconds.
a lot too.
Healthy.
She
She
knows
I don't
knows
see
a
any
lot.
edema or
Yeah.
crushing of the fingers.
She always does everything so perfect.
And
She
this
does
is
know
her
a
skin
lot,
target.
but she misses stuff too. It's not like
Yeah, I don't see any tempting. Her skin looks healthy and warm. Now auscultate for
What's your
aorta.
oh, okay.
Second right sternal.
Well, that's
border.
from here.
Not that I know.
Oh, okay.
So gallery and
Okay. Pulmonic, second left sternal border.
My name is Jameson. This is my video system.
Herbs point, which is third left intercostal space. Tricuspid, which is fourth left intercostal space. It's hard to find. And mitral. Okay. And if I suspected a heart murmur, I would use the valve with my stethoscope to assess her mitral valve. So I'm going to check your cardiac system, or assess your cardiac system. And assess your aorta. This is your second right
Bye,
sternal
James.
border.
Thank you.
And I can hear S2. And it says your pulmonic. The pulmonic valve at your second left sternal border. You can also hear S2 better. So check Herb's point, which is your third intercostal space. I can hear S1 and S2. And your tricuspid. Tricuspid is your fourth intercostal space. I can hear S1. And mitral. I can hear S1 here. If I suspected a murmur, I would flip to the bell of my stethoscope and assess the mitral valve there. And I would put her into the left lateral position, I think that's what it's called, or just have her lean onto her left side. I do not hear any bruits, and I do not see any edema. I have already checked capillary refill. Now we do pulses. Okay, so let's see how many of these I can remember. Temporal. Okay. Carotid. Check one side. Okay, apical. Heavy lean. Okay. Brachial. Okay. And a radial pulse. Okay. Femoral I'm going to skip. Probably that would be difficult in genes. Popliteal, I can try. That's a good job so far. Just like, yeah. Okay. posterior tibial. You are. Makes it difficult. Posterior tibial will be in the groove behind her ankle. Check on both. And dorsalis pedis would be on the top of her foot, near her big toe, next to her big toe. Preauricular, postauricular. Tonsilloid here, parotid cheeks in here. Occipital should be back here. Okay, there's submandibular, segmental, group deep, cervical,
I guess.
posterior cervical,
Well, actually, this is why I know that you know what you're doing.
supraclavicular. Your bed
It'll be
is
easier for you
lower.
to like
You
lift
don't
it
have
up.
your bed rails up, so I guess you're not lying down. Your collarbone is within reach. Do you need anything else? Okay. Your doctor will be in to see you shortly. I'm going to wash my hands and document everything. I think that's it.